So this week we are delighted to welcome to the podcast Dr Thivi Maruthappu. Dr Thivi is the UK's only dual qualified consultant dermatologist and nutritionist. She studied medicine at Oxford University and Imperial College London, completing her training in 2018 when she was appointed consultant dermatologist at the Royal London Hospital and the lead for severe eczema and psoriasis.
An accomplished academic, Dr Thivi has completed a PhD and a fellowship in medical dermatology at the renowned St John's Institute of Dermatology, in addition to a certificate in nutrition science from Stanford Medical School, USA. And her training has led her to adopt a holistic approach, considering aspects of nutrition and lifestyle that can contribute to skin conditions. So who better to speak with today? Welcome to the podcast, Thivi.
Thank you so much. Lovely to see you both today.
Great. So we're going to jump right in and talk about psoriasis today. So can we just start off by asking you, what is psoriasis and how does it differ from other chronic skin conditions that listeners might be more familiar with, like eczema, for example?
So that's a really good question, because it often gets confused for eczema, even by healthcare professionals. So it can be quite difficult sometimes to tell the difference between the two. Psoriasis is an inflammatory skin condition. It typically affects very specific areas of the body. So it loves the elbows, the knees, the scalp, sometimes the ears. So it has its little favourite spots that it likes to go to. It develops plaques on the skin, which are quite thick raised areas, and those plaques have scale on the top. So that's what we usually see when we're seeing someone with psoriasis. And you might just have two little plaques. You might be covered head to toe. It's a huge spectrum of disease, and we can help people whatever end of that spectrum that they're on. There are ways to manage it.
And how is it diagnosed?
So normally we look, so it's the story. So when did it start, the symptoms, and what it looks like when we see it. So it's normally just clinical diagnosis, so looking at it. But what really helps to make the diagnosis is if somebody in the family also has psoriasis. And about 30% of people who are diagnosed with psoriasis will have a family member who's also got it. There are some clues for psoriasis. So we look for nail changes. There are very specific nail findings in psoriasis. And there are specific things that we see, like psoriasis loves scars and any injury. So, for example, if you've fell off a bike or something and you've got a scar, you might see psoriasis running in the line of that scar. So there are some little clues that we use to help us.
As a GP, I'm always fascinated by how great you dermatologists are at pattern recognition when it comes to looking at the skin. I don't know how you do it.
I mean, I can get it wrong even now after all these years. You can get it wrong. It's easy to do, and sometimes you have to do a biopsy if you're not sure.
Well, that's what I was going to ask you. Are there any grey areas where you might not be sure?
Yeah, absolutely. So I'm looking after someone at the moment who's got eczema and psoriasis. So she's got psoriasis in the classical places and she's got eczema in the classical places. That's quite uncommon, but there are a few people who do have that mix of symptoms. So it is difficult. And sometimes if you just have one patch, it could mimic a fungal infection, for example. That's something that people often come with. They've got a fungal infection they think they have that's not responding to treatment. Eventually, when they start getting more and it starts to look more classically like psoriasis, then we can distinguish there.
Yeah, absolutely. And do we know much about the underlying causes?
We have a much better understanding. I don't think we fully understand, but there is a strong genetic basis for psoriasis, which is why many people do describe a family history of psoriasis. So we understand that there are genetic risk factors, but why even twins, one might have very mild psoriasis, one might have severe psoriasis, that we still don't understand. So there's a big environmental role to play as well. So we know that there's a genetic tendency, and then there may be some environmental factors which then precipitate it for it to actually appear.
Would they be the same environmental factors that precipitate sort of an inflammatory response or an immune response?
Yeah, so psoriasis has quite typical ones that streptococcal throat infection can trigger flares of psoriasis. Stress, any skin condition can be triggered by stress. COVID was a big trigger for psoriasis, actually. So obviously that immune dysregulation that we'd see with that. We did see people coming with just brand new psoriasis that was quite tricky to treat after COVID infection. And it can be triggered by skincare things. So if you've treated it with the wrong type of thing. So sometimes if you've used topical steroids for a long time, actually that can be counterintuitive and actually that can flare psoriasis. So you have to be a bit careful what you treat it with.
Yeah, absolutely. And how much would you say is genetic versus environment? Do we know the difference, or is it?
It's really hard to say. I mean, maybe 50-50. I mean, you've got to have a bit of a genetic, predisposition for those environmental triggers to have an effect. So, we're all exposed to those environmental triggers, but not all of us will get psoriasis.
Yeah, yeah. And what about the links to other parts of the body, not just the skin?
Yeah, so that's the bit of psoriasis I find so interesting, is that it isn't just on the skin. There is a correlation between inflammation in the skin and inflammation inside the body as well. And we see strong links between psoriasis and cardiovascular disease, so heart disease, high blood pressure, fatty liver disease, are all present with increased frequency in individuals who have psoriasis, and diabetes as well. We also see an increased risk of diabetes in people with psoriasis, and that is independent of body weight, because you could sort of think, oh, well, maybe they might have a higher body weight and that might be why, but it seems to be independent of their body weight, actually.
That's so interesting. And what percentage of people with psoriasis develop joint problems?
Yeah, so it's about 20%, 10 to 20% can develop joint problems over the course of their lifetime. It might not be joint, it might be tendons. So they might get tendon problems, and that might be the only sign, but they might get full-blown inflammatory arthritis, and that can manifest either as joint pain, stiffness, but joint swelling is one of the common presenting features, particularly in the hands and the feet.
And do we know what might lead someone to develop that? Is it an undiagnosed or an untreated psoriasis, or do we have any idea what triggers the joints and tendons to be involved?
Well, it's a bit tricky, because some people can have terrible joint disease and no skin involvement, and some people can have tons of skin and no joint. So they are not synchronous with each other. They could be doing two completely different things. One of the clues that someone might be predisposed to getting joint disease if they have skin psoriasis is nail involvement. So if you have nail involvement, you are at a higher risk of getting joint involvement. So we do monitor people with nail involvement closely, and often ask about symptoms of joint disease.
Okay, that's a good learning point for me, actually. Coming back to the role of environment, in particular lifestyle, we are obviously a plant-based nutrition podcast, and we're going to talk to you more about nutrition in a minute. But could we just delve into other things? You mentioned stress,
Yes,
and sleep. How much do these impact?
So stress is a huge factor for psoriasis, and I've seen people who just flare. They move house, they have a bereavement, they have a major life stress, and their psoriasis just flares, and they could be covered top to toe. And you can ask so many other questions. Did you have an infection? Did you start any new medication? But actually it correlates so closely with the stress, and it's a very well established trigger for flares of psoriasis.
And do we know more about why? Is it anything to do with cortisol itself, or?
Well, we have a much better understanding in, for example, eczema and acne, how cortisol does contribute to the either oil production or inflammatory cascade that leads to flares. But in psoriasis, it's much less clear how stress can precipitate psoriatic flares. For example, in eczema, we know that when you have slept less and you are under stress, your skin barrier is affected. Whereas in psoriasis, it's quite the opposite. The skin barrier is probably doing too good a job. It's too thick. It's too overdeveloped. So actually, we're not really entirely clear why stress particularly contributes to flares.
Wow, okay. And likewise, does exercise have an impact?
Exercise is beneficial, but the problem is people with lots of visible psoriasis often feel self-conscious about group classes, swimming, and sometimes if the plaques are rubbing against each other, it can be really uncomfortable. So while it is beneficial, sometimes I find that people really engage with exercise after their psoriasis is much better. So if we can manage the psoriasis, then they want to take part in an exercise program. So it can be a chicken and an egg type of situation.
Okay. Claire and I have only recently done, well, I say recently, it was about a year ago, wasn't it, the IBLM? So we've got lifestyle medicine on our minds. So we're going through all the pillars
Yes.
here. We haven't covered
They're so important. They're so important.
Toxic substances. What about things like alcohol and smoking? Are there any links there?
Oh, yes. Psoriasis is strongly linked flares to increased alcohol consumption, and smoking is a very strong precipitant for palmar-plantar pustular psoriasis. So it's a subtype of psoriasis which affects the palms and the soles, and you get these little pus-filled spots as well as very dry, thick skin. And one of the pillars of management is smoking cessation. And Alcohol, we always ask about alcohol, and we always recommend alcohol reduction because it's well known to flare psoriasis. It's pro-inflammatory. And so really there is no lower limit for how much alcohol. It should be as low as you can possibly manage. That's what I say to my patients, actually, which is, I think, a bit boring for some of them, but I think it really is that such an important part of psoriasis management to minimize alcohol intake.
Yeah, I think it's difficult, isn't it, as a clinician, when you know that is the advice, and not to then share that with the patient. I just think
Yes.
we need to, don't we?
And then I guess it's up to them, really, how they want to take it forwards. Yeah.
So, as Daisy mentioned, we wanted to talk about the evidence that's out there for connecting perhaps specific foods or dietary patterns to managing psoriasis. And we actually found you for this podcast through the Apple study,
Yes.
which was, to summarise, asking people with psoriasis about lifestyle and eating. So can we maybe start by discussing how you came up with the idea for the study?
So I was running a psoriasis clinic at the time, and everyone asked me about food, and it is not part of our training at all. We didn't have a lot to say about it. We just kind of be like, well, maybe, but actually here's a treatment. And it was odd to me that we could talk about treatments, some of them very strong treatments like methotrexate, which is a tablet treatment that we use for psoriasis. We felt so comfortable talking about all the side effects of methotrexate, but then someone asks you about gluten and you're not able to give a good answer. And I thought, how has that happened? And so I decided to sort of make that a little niche. And the more I did it, the more people asked me to speak about it. And that just grew and grew. And the Psoriasis Association is one of their pillars, actually. The role of diet and lifestyle is what their members really want to know about. So myself and Professor Wendy Hall, who's based at King's, applied for funding to do more research into psoriasis. And we just wanted to learn, what are people doing? What diets are people trying? What things do people find helpful? And then after that, we did a little trial as well to look at how dietary interventions could help. But a lot of the studies had been done in other countries, Mediterranean diet in people who live in Spain. And so we really wanted to make something that was relevant to the UK population and find out what people living in the UK are doing in terms of dietary patterns that they might have tried for their psoriasis.
Did you feel that you were starting with a blank canvas in terms of what diets might be useful? Or, was there something that you were hoping to show with the study?
Yes, so there had been some data, some observational studies that had looked at Mediterranean diets, and that made complete sense to Wendy and I, because the Mediterranean diet is used to manage cardiovascular disease. You could go and see someone about a fatty liver, you'd be told about a Mediterranean diet. I thought, look, this is really addressing lots of the comorbidities that people with psoriasis are prone to getting. And so that would be really interesting to explore more. And so that's one of the types of diets that we were looking at. We also looked at intermittent fasting or time-restricted eating, which at the time there was sort of growing evidence for it, for cardiovascular disease in particular. I think now people are a little less excited by intermittent fasting, but at the time we were writing this, a good 5-6 years ago, it was really topical. And so we wanted to look at those particular eating habits, and we also just wanted to see what people with psoriasis ate, what was their diet like compared to dietary guidelines, how close were they, and were there any foods that they were eating more of that could potentially be harmful.
What did the Apple study show then in the end? What guidance did it give you about how to advise patients about how to eat?
So it was really interesting in that we have known for many years that psoriasis is strongly linked to obesity, and that is the number one dietary factor that we aim to address when it comes to managing psoriasis. So if patients have psoriasis and are obese, they should be given very stringent dietary guidelines for weight reduction, because it seems to have an additional benefit beyond just treatment alone, beyond making treatments more efficacious. So weight is a very important part of managing psoriasis. And we found that actually most of the participants in our study were overweight or obese, actually, those living with psoriasis. So it really corroborated what was already out there. And when it came to dietary patterns and what foods people were eating, we found in particular that from this study and also from other studies that red and processed meat were factors associated with increased severity of psoriasis. So that's something we had been saying for a long time in clinic was really important to reduce in your diet, but it was reassuring to see in this. And we also saw it in another study where we looked at UK Biobank data, which is over 2,000 people who live with psoriasis. We were able to see that again in that set of study data as well, that red and processed meat intake was linked to more severe psoriasis scores. All of those things are associated with other cardiovascular comorbidities. So it was a very important area to address. We also saw that increased plant-based proteins and nuts, fruits and vegetables, all the things I don't think it should be a surprise really to anyone, but all of these things that we know to be healthy were associated with lower psoriasis severity scores. So I think it made what we had a hunch about, it made it clearer. And also it's quite good for people who work in psoriasis management to have more information for a UK population on dietary guidance.
So I can imagine as a patient, you're probably quite used to being bombarded with lifestyle advice about how to improve cardiovascular risk factors. And what they might be interested in is, how do I just make my skin better and have less severe outbreaks of this skin condition? Do you know anything that, you pass on to the patient, or that you could explain to us now, maybe as health professionals listening, about any of the mechanisms about why a plant-based diet might influence how severe psoriasis is?
So one of the important things that we understand behind psoriasis inflammation is the gut microbiome and gut health, and obviously a plant-based diet, whole grains, nuts, fresh fruits, vegetables, fibre-rich food is so important for the gut microbiome. That is the focus of further research that we're doing in our department. So obviously that is a diet that will really help to optimise the gut microbiome and therefore anti-inflammatory. And also we're avoiding foods that could raise cholesterol, for example, so high-fat dairy products and red meat in particular, which could then have an impact on lipid, cholesterol levels, cardiovascular disease, blood pressure, all of those risk factors later down the line. In terms of specifically how is it modifying psoriasis, well, olive oil, nuts, seeds, all of those things have healthy fats, omega-3s, and all of those things are anti-inflammatory for the skin and important for healthy skin function. And fruits and vegetables are full of those wonderful antioxidants, which are also super important for being so anti-inflammatory as well. So I think it's just the balance of all of the components that's the most important thing. And in clinic, what I find is people want easy things that they can do. They want small bits of advice and swaps. So sometimes it's not about a complete diet overhaul, because sometimes I think that pushes people away and they don't want to come back and see you again, because they're just going to keep, that person's just going to keep telling me to stop eating da-da-da-da-da. So I might start with easy things like snacking. And from our research, we found that late night snacking is associated with increased psoriasis severity, particularly if that's on crisps and biscuits and things like that. So swapping, if you're going to snack, try and do that earlier in the evening, and try and make that on some fruit and some nuts, for example. That would be a much healthier snacking combination. And if you come to patients with the evidence that there is an association of late night snacking, particularly on less healthy foods, with psoriasis severity, that's a small thing that they can take away and do. It feels much more doable than if you tell someone, right, I want you to adopt this entire new diet. So I think those small things are the things that I often talk about in clinic.
Yeah, and obviously as someone with nutrition training, that's much easier for you to do that and to hear something about somebody's diet and then maybe mirror back to them what might be a good change within that. But how do you think these dietary approaches in general can fit alongside some of the standard medical treatments, some of the things that patients go through? They might be, well, you can enlighten us, but obviously there are biological treatments, phototherapy, creams.
So when I talk about a holistic approach, I'm always thinking of four things, nutrition being the foundation, so making sure that we've addressed that. Then I always talk about mindfulness practice. So you need some sort of practice that is for stress reduction in your life if you've got an inflammatory skin condition. So first we start with diet, second is a mindfulness practice, and then we move on to topical treatment. And that might be prescription topical, it might be over-the-counter topical. And then medical treatment is always available. So that could be tablets, it could be injection, as you mentioned, biologic therapy. And you don't need to work through, you don't need to, it's not 1, 2, 3, 4. You can do it all. And some people, they may need to go straight to medical treatment. If it's very severe disease, if it's having an impact on their psychological well-being, which skin conditions naturally do, you may need to go straight into medical treatment, but still talking about the diet and lifestyle along the way. So, but if you've got someone with mild psoriasis and you talk about diet, lifestyle, and maybe a little bit of topical treatment, actually that's quite appealing to people. And I find patients are very receptive to talking about all of these things. Another finding we found is that although people who live with psoriasis are desperate to hear about diet, in our study, only 7% of people were given dietary advice by their healthcare provider. So there's a huge disconnect between what people actually want to hear and what information they're being given. So I think the other thing is, I think perhaps not your audience, but lots of people who work in looking after patients with psoriasis are a bit nervous to talk about diet because they don't know what to say. And we've tried to make it really easy to talk about it with lots of the information that we give and things that are available for our colleagues to use, for example.
So out of everything, it might be a piece of advice that you give to your colleagues as well. But out of everything you've talked about, so you've talked about reducing red and processed meat, talked about increasing fibre and looking after the gut microbiome, and you've said about how often patients haven't got a diet that's terrible, but if somebody had a bad diet or you wanted to help a colleague to put in a bit of nutrition advice into their consultations, what would you focus on?
It's really difficult, isn't it? Because it varies from person to person. But I think the really heavily processed foods are problematic for a lot of people. And I have so many patients who have really tried hard to cut out a lot of that from their diet, and they have really seen improvements in their skin. And I don't understand the mechanism fully, but it might be that, we're dealing with emulsifiers, which have an impact on your gut microbiome. It's not clear, but really trying to eat as much as you can, whole unprocessed food, and if you can, homemade food, and going back to basics. Really, it's not complicated. It's not all the supplements that are the answer. And often people come with bags of supplements and say, well, I take all of these and I've still got this, that, and the other. And actually, it's the really simple, I hate to say, but boring things that are the most powerful, and just taking care of yourself. And it's a mindset thing, because some people with psoriasis, they've lived with this visible condition. It has really affected their self-esteem. There are lots of psychological things at play here. There may be self-esteem issues that stop them wanting to eat properly. They don't feel they're worthy of cooking proper meals or spending money on food. And there may be binge eating. So some of our research we looked into, there was comfort eating in the evening, and some of that late night snacking. Well, why are you late night snacking? Is it because you've had a very difficult day and you've had to sort of have people looking at you differently all day, and then you come home and you comfort eat? So thinking about the underlying piece of why these patterns of eating are there, I think is so important.
Yeah, I completely agree. I think when you're thinking about that one piece of advice, it's always looking at the person and looking at what's affecting them, isn't it? And trying to tailor it to that. You mentioned supplements. How does that work with psoriasis? Are there any supplements that you're telling people might be a good idea?
So we always recommend vitamin D testing and then supplementation. At least supplement throughout the winter. I tend to actually say to my psoriasis patients, supplement all year, 1,000 micrograms daily, unless we've measured it and it's low and they need more than that. So I think that's super important. Omega-3 supplements, and you can do an algae-based omega-3 if you are unable to get adequate amounts in your diet, is something to think about as well. Apart from that, supplements, there isn't a huge role for supplements in psoriasis. I have a lot of patients who want to know about probiotics. There have been a few trials actually looking at the effects of probiotics. Some of these have shown improvement in skin severity scores, but often the placebo response is quite high as well. And whether people are making other lifestyle changes because they think they're taking a probiotic, that is unclear as yet. So it's not that we have a particular species that we think is really relevant to psoriasis, but if a patient wants to take a probiotic, I'll say, look, yeah, take it for 8 weeks and see if you see any improvement, but don't fiddle around with lots of other things at the same time, because you won't be able to tell. So I think there's no harm in taking it, potentially a benefit, but if it's not helpful, obviously stop it. And of course, it's much more beneficial to get it through your diet.
Brilliant. I mean, that's really good advice. I hope lots of people have heard that. If you're not sure if something's going to work, then just make one change at a time. And I think as well, it's good to be really clear on supplements, because it's much easier for us to remember to just say, actually, there's no good evidence for supplements, than for us to try and remember as GPs lots of different studies and things that might be worth a try.
I guess in that vein, there are people who do sort of juice cleanses and things like that, and very extreme diets for psoriasis. And sometimes people come and see me and they say, look, I've done this diet, I've cut out da 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 da, and I'm just having juice cleanse, or I'm just having rice 3 times a day. But when they start eating again, then sometimes they can run into problems. And you can't live on a juice cleanse. That's not sustainable. So whatever the dietary changes are, it's got to be a long-term sustainable change for you. There is also a link to celiac disease and psoriasis. So people who have psoriasis have an increased likelihood of having concomitant celiac disease. So that's something I would always ask about in the clinic. I'd ask about symptoms, family members who have it, and screen if appropriate. Because sometimes if you're not addressing the celiac disease, the psoriasis is very stubborn and doesn't clear.
Oh, wow. That's another really interesting learning point for me. But Thivi, I love your message about just actually nutrition can be quite simple. We know the foods that are good for us, the fruits, the vegetables, whole grains. I mean, we talk about these foods all the time on this podcast, but I just wanted to circle back to, you mentioned plant proteins.
Yes.
Could you tell us a bit more about where that came into the study?
Yeah, so that was a UK biobank study that we did, and what we found was that those who had plant-based protein sources had less severe psoriasis severity compared to those who had animal origin protein sources. Some of that hasn't been published yet, but interesting.
Yeah.
And definitely something I talk about in the clinic as well, trying to incorporate increased sources of plant-based protein.
And do we think that's something inherent about plant proteins, or was that an exclusion of the red meats and the processed meats?
You're asking exactly the right question, which is what we were all talking about at the time when we were presenting the data. Yes. So it might be that it's removing a source that is potentially pro-inflammatory and replacing it with one that is anti-inflammatory.
It's always that what if, what instead of what, isn't it, in nutrition?
Yes.
But I suppose there's so much fibre in plant proteins. That's the other thing people don't talk about, actually, that the protein comes with fibre, which is such a benefit.
And all sorts of other micronutrients and antioxidants that come with it. So it's the package. And you wouldn't be able to do a study where you say replaced it with like a pea protein powder or something like that. I just don't think that would give you your answer.
Yeah, fascinating. Oh, I'd love to have you as my dermatologist. I mean, to go in and speak about nutrition and mindfulness before we even get onto creams and tablets, that's just a dream, isn't it, Claire?
Do you need a dermatologist, Daisy? I've never noticed any skin problems.
I did have eczema when I was a child, but maybe the plant-based diet's cured that. I don't know, but no. But yeah, I'm sure lots of people would love to see you, Thivi. And it's a really interesting career path that you've taken, the combining nutrition and dermatology. Was there a particular reason you went down this route?
I just saw that people weren't doing it, and it was an unmet need. And I just I just kept putting one foot in front of the other, and it just all happened very organically. It was just as soon as I started doing it and giving talks on it, suddenly I was invited every week, and I still am invited all the time to speak on this topic, because it is the question that people asked as GPs, and I speak to GPs, dietitians, nutritionists, dermatologists, dermatology nurses, obviously lay people as well. So the audience who want to know about it doesn't show any signs of slowing down. I actually have a colleague now who's trained in nutrition, so I'm so pleased. And she's doing her PhD at the moment in psoriasis and nutrition, and that is just fantastic. So I think there will be more people coming through who also have nutrition training, which I think.
I was going to say, you need to clone yourself, because you can't be everywhere.
No, but I have lots of colleagues are really interested in it, actually. I've noticed that there is a big uptick in people who are trying to bring this in, because the evidence hasn't been good enough for anybody to want to talk about it. And I guess it took a lot of time to go through the data and make it manageable and bite-sized so that people could talk about it in their clinic. And that, I think, was the hardest part, is taking all the literature and looking at it and trying to make sense of it in a way that you could talk to a patient.
I was going to come back to your colleague that's doing the PhD in nutrition, and because we wanted to know what is the direction of travel for this? And it sounds like, you've got as far as collating everything that's out there and seeing what you can derive from that. You've got some questions about whether it's adding things into the diet or excluding things from the diet that's the benefit. I don't know whether the PhD that your colleague is doing is the new direction of travel, or if you had any other thoughts on that.
Yeah, so her PhD is mainly focusing on weight reduction in people with psoriasis. There has been a general observation amongst people who work in psoriasis that these new drugs that help with weight loss may also be beneficial in psoriasis management in people who have severe obesity, for example, and whether they can be used as an adjunct to diet, lifestyle, medical care. So there's the weight loss part. Our research, we're going forward with some gut microbiome work that we're doing. We've just published a scoping review on probiotics and prebiotics in a variety of different skin conditions, and we are applying for more funding to extend the project that we did, which was quite a small project, to a much larger study as well. So that would be interesting to do.
I can't remember who I was listening to the other day who was also a clinical researcher and was saying that sometimes it might not be an exciting finding, but when you do studies and they support other studies and you start developing more and more evidence that's the same, but actually that's really what gives the power, doesn't it, of that particular finding, I suppose, is repeated patterns of the same thing over and over again. That was just
Walter Willett.
Absolutely.
You were listening to him.
Was it? Yeah. Oh, I should have remembered that it was Walter Willett.
Walter Willett.
Mm-hmm.
Yeah, I guess what we're doing are small steps that adds to the weight of information that's out there. But we have had such a good response from the psoriasis community, who have been so relieved that somebody is looking at it at last. And I guess the most important thing about the work that we do is that I work with amazing dietitians and nutritionists who help to, really power all of these studies and design them and things like that. I can come in from a psoriasis point of view, but nutrition science research, as you know, if you don't do it properly, it's there are so many studies out there that are not adequately carried out, and working with people who do this all the time. So as I mentioned, Wendy Hall, Rachel Gibson, we have a really great team at King's who carry out clinical trials day in, day out. And so that has been so eye-opening for me, and it's been such a great learning experience.
No, it's brilliant. You can bridge the gap into clinical practice as well. And I think patients, it would be obviously great that they can see the skin changes, but actually with the links with cardiovascular disease and diabetes, you're not seeing all the internal effects, that you're reducing the risk of cardiovascular disease for them and all those other comorbidities. And so we know how important that is with with plant-based diets.
Absolutely. And that's a long game, isn't it? That's the long game. And one of the things we found from our trial, which was so interesting, is the people who were on the Mediterranean arm of the study, these are the people we shipped them almonds, bags of almonds that they'd have to chew on multiple times a day. They have very specific dietary intake requirements. They had improvement in their happiness scores. So we did a happiness score called a WHO5. It looks at 5 elements of happiness. And the people who did that arm, their happiness scores improved disproportionately to their skin. So there is something about the profound effect on diets that really are focusing on increasing plants and plant-based foods that must have some impact on the gut and the gut-brain axis, because it was so clear from the data that even in this small study that patient feeling good about themselves, which is hard to do if you live with a chronic skin condition, that was markedly up in that particular arm of the study.
That's lovely. I mean, it's just so wonderful to hear that there's no conflict in eating for your skin with other areas of your health. It's not like you've got to do something that might make your skin better, but you're suffering somehow internally. So coming to the end of that set of questions, we wanted to ask you, is there anything else that in today's conversation hasn't come up that you think's interesting to add here?
I guess I should always say that there are people who have absolutely beautiful diets and manage their stress and do all the right thing, but still have very severe psoriasis. And I wouldn't say it's a cure for everybody. I think there are some people who see really amazing results from changing their diet and lifestyle, and some people who get really frustrated that they feel they're doing everything and their skin is still really flaring up. And I guess there are some people where the psoriasis is very strongly genetic, and then there are some people whose psoriasis is very strongly linked to lifestyle, in the same way that we see with diabetes type 1 and type 2. I think there may be a similar thing with psoriasis, where some people where lifestyle factors can have a huge impact and they can clear their skin, and there are some people who it has less of an impact. So I think that people shouldn't be disheartened if they've tried dietary methods. You should still keep up that diet and lifestyle change, because it's important for your long-term health, well-being. And then there's all these amazing new medical treatments that are really changing the landscape of living with psoriatic disease.
Such an important point.
Great, thank you, Thivi. So, concluding the conversation, we love on this podcast talking about food, so we can't let you go without asking you what would be your favourite plant-based dinner, or what are you having for dinner tonight?
So mine, I guess it's not super exciting, but it's so homely, and it's dal and rice. So I'm from Sri Lanka, and we have a very specific way that we make dal, red lentil dal. We use coconut milk, and we use a lot of turmeric and lots of spices. And obviously all of those are so wonderful and anti-inflammatory as well. And with some brown rice and some coconut yogurt, I think that would be delicious.
Sounds perfect, doesn't it, on a winter's evening after work?
And you can have it in a bowl.
Nice, yeah. And leftovers always taste better the next day as well.
Yes, yeah. I put sweet potato in my dal, actually. My kids love that. So my mum says it's not actually, the traditional recipe, but it's good.
It's your take on it.
You can always build on a traditional recipe, I think.
Yes, yeah.
Mine, I haven't got a recipe to share, because I'm actually going out to some friends tonight who are doing, all that I know is that it's an Italian themed evening, and they know that, I'm going to need to eat plant-based. So I'm not sure what they're going to do. I know that the husband in the couple makes a fantastic focaccia bread. So I'm looking forward to that.
Wow. That's nice, and a little surprise for you tonight.
Yeah. What about you, Daisy?
Oh, Thivi, I get obsessed with an ingredient and I just make it over and over again. And my current obsession is actually soya chunks, which I actually have probably spoken about this loads of times.
No, you've spoken about soya curls.
So I bought the Made in Hackney, our Sarah Bentley's book, which is an amazing book, by the way, and we'll link it as well. And she's got this really interesting way of making soya chunks, which are dead cheap, dead easy to make. You just rehydrate them and drain them, and then you sort of pan fry them. But the interesting that she does is she takes them out halfway, adds her soya sauce and spices, and then puts them back in again. So it's so easy. It's like 3-4 minutes and they're ready to go. And then I put that in a stir fry. So I love a broccoli, cashew, hoisin type stir fry. So yeah, that's my current obsession is soya chunks.
Lovely.
Great. So on that note, we just wanted to say thank you so much for your time. We can tell you've had a busy clinic this morning and you've squeezed us into your Friday. So we really, really appreciate that, Thivi. Thank you.
So lovely to speak to you both. Thank you. Thank you for having me on.
Thank you.
And if people want to connect with you, if they want to find out more about your work or come to see you as a clinician, I tell you, if I had a dermatological problem, I'd be straight there. How can they find you?
Oh, thank you. So I'm on Instagram. I don't update that much anymore because my clinics are just really busy at the moment. So I do have an Instagram, Dr Thivi Maru. If people want to read more and learn more, I have written a book called Skin Food, and that covers psoriasis, eczema, acne, all common skin conditions. And I do lots of speaking. So I think I'm speaking at the Primary Care Dermatology Society next year, MIMS as well, the MIMS update. I think I'm also speaking at the Primary Care Gastroenterology meeting on the gut-skin axis next year as well. So I'm around.
Oh, fascinating. Maybe our paths will cross then.
Yes, that'd be great.
Thank you so much.
Pleasure.